physical exercise is really good. Staying socially active, which has been hard for our older population in the last couple years with the COVID pandemic.
Hi, this is Jerry from Touching Hearts at Home here in Kootenai, Idaho. Today, Linda Henrich is joining us. She is an amazing expert in Alzheimer's and dementia in our community. She's a wealth of knowledge, and I can't wait to hear what she has to say and share with us.
My name is Linda Henrich, and I am an RN. I actually have a doctorate in nursing practice, but it's related to nursing education, not so much in the practice area. I'm also a board-certified geriatric nurse and also certified through the Positive Approach to Care organization as a dementia care coach and a dementia care trainer.
That is really intriguing. I think we'll get into that here in a little bit. But what is dementia? Give us a little bit of an understanding of that.
Well, actually, the new appropriate term is neurodegenerative disease. And that really explains what it is. It's a degenerative process of our brain. And so our brain just slowly deteriorates over time, which affects our ability to socialize, our ability to care for ourselves, and just interact in society.
So is it, it's progressive, and is that right? I mean, it's progressive, and how do you know you're going to get it, or do you? Is there any indicators early on?
It is progressive for sure, and there is currently no cure, and there really isn't much in the way of treatment. As for knowing whether or not you're going to get it, there are some genetic markers if there's a family history, but there's not anything strongly that says if your mom had dementia, you're also going to have it. It just kind of it's just another risk factor. Mm-hmm. So, and age is the number one risk factor for getting dementia. There's many different types of dementia, and so that is another, risk factor. So you have vascular dementia. So anybody with high blood pressure, cardiovascular disease, that type of thing has an increased risk for strokes, which then increases their risk for vascular.
That gives it a little bit. Disease. So it's important to keep yourself as healthy as possible.
Yes, and that is exercise is really good. Physical exercise is really good. Staying socially active, which has been hard for our older population in the last couple of years with the COVID pandemic, is really important. And then exercising your brain, just like you exercise any other muscle in your body. So brain games, puzzles, anything that can make you really have to work your brain.
So recently I saw an article about the interaction with some medications. I know you've talked about that to me before. Can you give me some examples of how some medications can cause dementia-related type of symptoms or something like that?
I can. They're very limited because I'm not a pharmacist. But there's a category called benzodiazepines, and those are usually prescribed for anxiety disorders. There's other safer drugs that can be used in the geriatric population, which is 65 and older. Some of our antidepressants are called SSRIs, or selective serotonin receptor
inhibitors.
Just went blank. Thank you. That one. Yeah, inhibitors. I have another friend back here helping me. So some of those actually work to reduce anxiety, even though they're classified as an antidepressant. But using those can cause an increase in confusion, increased sedation, with just withdrawal, and you don't use your brain a whole lot when you're taking those.
That was amazing. Thank you, Linda, for such an amazing and just such an amazing discussion about dementia and Alzheimer's. There was some good nuggets in there. I'm definitely going to be sharing that with my team. If you have need for support in your home, please give us a call. We're at touchinghearts.com CDA. Thank you.